We also translate information in terms of cartoons and animations, just to simplify information, to make sure that each and every person in the society is understanding the contents of government policy. So as PMRC, we're doing that.
It is my honor to welcome you all once again to this occasion as the Policy Monitoring and Research Center, PMRC, shares the findings of its research study titled Malnutrition Among Children with Disabilities, Challenges and Opportunities for Zambia. PMRC has done a lot of work under its social development and livelihoods thematic area. This is evidenced by the several publications that we have managed to translate into Braille, and we shall be handing them over to our distinguished stakeholders for distribution and educational purposes. And PMRC has undertaken this initiative so as to contribute towards increased access to information, especially to societal groups that have been marginalized in the past. We believe that this undertaking will go a long way towards enhancing the capacities of the differently abled people to be informed and also to participate from an informed perspective in various issues in the nation. Honorable Minister, ladies and gentlemen, the World Health Organization estimates that over 1 billion people, representing about 15% of the world's population, have some form of disability. Coming closer to home, the World Health Organization estimates that 1.3 million people in Zambia are disabled. So this amounts to approximately 7% of our population. It is no secret that in our country and world over, differently abled persons, especially children, face stigma, discrimination, and are often deprived of full participation in our society. Many a time, this discrimination has deprived our children living with disabilities of educational opportunities, good medical services, and proper nutrition. It is a well-known fact that there is a bi-directional link, like my colleague had mentioned in the beginning, between disability and poverty. And disability may increase the risk of poverty, and poverty may increase the risk of disability. This makes disability a developmental issue that should not be taken lightly. Beyond providing evidence-based recommendations to policy and program implementers, PMRC's other mandate is to ensure that the country has an informed general citizenry with up-to-date information that empowers them to make decisions that will improve lives and that of their communities. It is for this reason, Honorable Minister, that we saw it fit to undertake a study that would empower both implementers and beneficiaries of various disability and nutrition programs with information that will lead to better program implementation and realization of program goals. The study used, among the several methods, the evidence of lack of iron to analyze the relationship that exists between nutrition and disability. There are a number of points of convergence between child disability and malnutrition in Zambia through the levels of stunting and prevalence of anemia, which is a lack of iron in children. It is our firm belief that the research findings and accompanying recommendations will be insightful in shaping social protection interventions for the differently abled persons. Honorable Minister, we thought that we take that route of actually going to undertake such a study through surveys and research, because as we know, other countries are doing very well in tackling their problems through research and development. But Zambia has been lacking on that end. And we thought we'd take it seriously and look at it from that light, other than depending so much on statistics coming from Zambia Statistical Office, Stats, and other partners. So we thought it fit that we do it in this manner. Today, we are also handing over the following publications which have been translated into Braille. So we have Malnutrition Among Children with Disabilities, Challenges and Opportunities for Zambia. That's the number one. Then we have a second one that has been translated from the 7th National Development Plan infographics. The third one being the importance of mindset shift, the implementation of the 7th National Development Plan. And fourth, which is the empowering persons with disabilities, assessing implementation of the national policy on disabilities. So this is an important undertaking of the organization to cater for the visually impaired and as a means of our community outreach and engagement. Allow me to take this opportunity, Honorable Minister and colleagues, to urge and encourage the Ministry of Community Development and Social Services, your EVO office man, the Zambia Agency of Persons with Disabilities, and their implementation partners to take on some of the recommendations highlighted in this study for program design and implementation. To our media partners, I'd like to urge you to help disseminate this information to the general public as we strive to achieve a well-informed citizenry and living by the commitment of not leaving anyone behind. Thank you.
To be a part of this auspicious event of the launch of a research by PMRC entitled Malnutrition Among Children with Disabilities, Challenges and Opportunities for Zambia. Let me begin by extending my sincere gratitude on behalf of the government of the Republic of Zambia to the Policy Monitoring and Research Center, PMRC, for the effort taken to translate several informative research publications into Braille. Ladies and gentlemen, according to the Zambia National Disability Survey of 2015, 4.4% of children aged 2 to 17 are children with disability. Disability rates were found to be higher in urban areas. And in terms of gender, there are more females that have a disability than males. The Zambia Demographic Health Survey of 2018 also presents the prevalence rate of stunting among children at 35%, down from 40% in 2014. A further 9% of children have a low birth weight of less than 2.5 kg. This can be an indication of lower than normal development before birth, which can also be alluded as a result of maternal malnutrition. Ladies and gentlemen, as you are aware, children are more prone to malnutrition than adults because children must be fed, and if their guardians or parents are vulnerable, the situation is even worse. Government, of course, attaches great importance to the welfare of children and endeavors to provide an enabling environment which is in the best interest of the child. My ministry is therefore concerned with cases of malnutrition among children that are being reported, more so among children with disabilities. Distinguished guests, the study being launched today will serve as an important tool to enable government and other stakeholders respond to challenges of nutrition, especially among children with disabilities. Ladies and gentlemen, there is an increasing international interest on the link between malnutrition and disability. Both are key human rights concerns, and they are currently prominent within the global health agenda. Government is, of course, very much aware of the fact that strengthening links between nutrition and disability will lead to enhanced benefits for persons with disabilities, especially children with disabilities. Distinguished guests, my ministry notes that throughout the life cycle, malnutrition can cause or contribute to an individual physical, sensory, intellectual, or mental health disability. By working more closely, nutrition gaps can be identified early in one's life cycle and ensure they are reduced. It must be noted with great concern that nutrition services and programs for children and adults can address and in some cases avoid and mitigate disability. At the same time, disability programming should be tailored with nutrition-sensitive messages that will enable good nutrition knowledge as a lifestyle among persons with disabilities. Evidence shows that nutrition-sensitive social protection program can successfully contribute to the reduction of malnutrition. Bearing this in mind, my ministry is implementing the social cash transfer program, which presents a unique opportunity to use social protection as a platform to improve chronic malnutrition and stunting in Zambia. I wish to stress that nutrition remains an important remedy for improved well-being of all our people, especially for children with disabilities. Distinguished guests, ladies and gentlemen, the government of the Republic of Zambia, headed by His Excellency Dr. Edgar Chagwa, is committed to stepping up efforts to reduce stunting and other reforms of malnutrition. I assure you, as a government, that there is a high level of commitment and momentum for multi-sectoral action on nutrition. As a country, we should ensure that nutrition services delivery across the country is strengthened and expanded. Ladies and gentlemen, it should also be noted that access to information for persons with disabilities is an important component of development without leaving anyone behind, as emphasized by His Excellency the President. It is gratifying to note that this research has been printed in Braille format, giving an opportunity for the visually impaired to access information. Government acknowledges the important obligation of translation of key national documents to ensure accessible information for all. PMRC have also done a commendable job of translating the 7th National Development Plan and the National Disability Policy into Braille. I commend you, PMRC Director, and your team for this development, and the action should be emulated by other stakeholders as this promotes citizens' participation and dissemination of vital national information, thus leaving no one behind. Distinguished guests, ladies and gentlemen, I am very confident that the materials being launched and handed over today will help inform relevant stakeholders in their programming to enable their service delivery become nutrition sensitive. I also wish to urge the recipients, organizations to utilize this information and knowledge that will be gained from the materials to articulate issues for dialogue with the communities that they serve. I hope that we shall continue to build on these partnerships, and with these remarks, distinguished guests, ladies and gentlemen, I want to wish everyone a very good morning as I officially launch the PMRC entitled Malnutrition Among Children with Disabilities, Challenges and Opportunities for Zambia. Please hold. Jillian, do you want to say something?
Can you first remove what? Yeah.
Okay. Thank you, Honorable Minister. So she said something, and we got this one. The baby also likes it. Thank you very much.
So we can just display the infographic for just to see. So there we have it, ladies and gentlemen, the infographic of the publication, which is a wealth of information on a single one-pager, and that will also be distributed massively. A big round of applause for PMRC and the Minister for that. Thank you so much.
So we'll just hand over to the minister to kindly give to our guests.
So maybe just before, I think our two most important women are here. And I think this publication comes at the right time. And I hope within our institutions we can actually use the data that has been given to us by PMRC to obviously create an enabling environment and obviously reduce the levels of malnutrition within our children living with disabilities. And also just to call upon our other stakeholders, for example, the Ministry of Youth and Sport. We know that they're also looking after especially street children who could also be disabled. We're also calling upon partners like the Ministry of Health, where actually health matters lie. And also the Ministry of General Education. We know that we have feeding programs. So there are a lot of other stakeholders, and I hope that this publication can also get to these various ministries so that whatever information is actually given in these documents could also be implemented, because we have a lot of children living with disabilities that are in school, and so within the feeding programs and the data that has been given by PMRC, it can actually be utilized. So thank you very much. I thought
More encouragement. I will be very demanding of more claps from the audience as encouragement. And also to thank PMRC for this gesture that they've gone ahead to actually produce. So thank you so much for that.
I think she has something
Okay,
to say.
Just gratitude, Honorable Minister, Community Development and Social Services, and PMRC, and all the invited guests as well as the media. I think for us, this comes in time. I remember a discussion I had with one of the officers right here from PMRC when we were in Johannesburg. And we were in a shopping mall and we saw this woman in a wheelchair and her legs were swollen. The conversation we had was that there's an intricate link between nutrition and disability, and how improper nutrition can actually lead to progression in disability. So we are very grateful that the PMRC actually took time and conducted a research on this, which is going to inform a lot in terms of how children are taken care of, and even persons with disabilities. You can't imagine what eating the wrong food can do to a person with a disability. So we are most grateful, PMRC. This is really going to be helpful, even in our programming and coming up with activities that are aimed to improve the welfare of persons with disabilities. This is really going to be of great use. Honorable Minister, thank you. This is in time. Thank you so much.
Here we have it, the handover being done by the Honorable Minister.
Honorable Minister and Director PMRC, we are so grateful that you recognized us also to receive these Braille materials. We are trainers of trainers, so we know that this information in Braille is going to help our students as we train them. And we very well know that a child that is malnourished cannot attend class, cannot concentrate fully. And we know that most of the conditions that we have in disabilities, they also are related to some nutrition. So thank you very much. I'm here with one of my HODs who is under Braille, and she's very happy with this.
Handover being done by the Honorable Minister. Thank you.
I'd like to take this opportunity to thank the Honorable Minister for always facilitating the library is relevant to society and making sure that through the grant that we receive through the ministry that we are in existence and are able to make these publications possible. We are truly grateful that you constantly have left your office open for us to come when in need. And also the Zambia Agents for Disabilities for always being there for us and helping us to make sure that we are able to publish material in this context for in accessible format for persons with disability, for visual impairment specifically, and for bringing to life the leaving no one behind concept in the 7th Development Plan. With PMRC, we are indebted to you, knowing that our clients definitely will have information that will aid them in helping to prevent malnutrition among children, and in so doing definitely will protect the future for Zambia, and we will contribute to the development of the nation through the government. Thank you very much.
Yes, well, I'd like to be joined by yourself as head of research and the custodian of our works at PMRC, which is research. And so if you could represent yourself, sir, and the researchers who are at hand.
Okay.
Over this way.
Thank you.
Kindly come to the other side of the minister as well.
Okay. So here we have it, ladies and gentlemen, the 2021 National Budget Infographic, which is a one-pager that basically details the 2021 National Budget, looking at expenditures, revenues, and also key highlights under all the 5 pillars of the 7 NDP, as well as all other different forms of taxation. So with this, we're going to finish reading this infographic, then you have the whole national budget at your fingertips and you know all the figures. So this is another innovation by PMRC, and at this point in time, we are officially handing over this A1 infographic to the minister, which will be displayed at the ministry. Thank you.
Thank you very much, and I'm sure it will allow everyone to actually articulate and understand the budget better. And I think this year's budget, everybody will attest, it has really been pro-poor. Our ministry has actually been a huge beneficiary, especially during the COVID and post-COVID. And of course, we're very grateful to the government and the Ministry of Finance. And indeed, this is what this government stands for, poor. And I'm sure, I hope everybody will be allowed to go away with this so that they can even take, it's important that people understand, especially the people that are living in our communities, because most of our people do not understand what the budget entails, what does it mean economically for us in terms of taxation, etc., etc. So it's important that everybody goes, and I hope the distribution will be countrywide, so that it's easy for them to articulate the budget. So thank you very much. We'll be displaying it this morning. The second study was, or rather, the second work done by PMRC was an analysis of the Auditor General's report on the social cash transfer in Zambia for the period 2014 to 2017. As we all know, social cash transfer is one of the key social protection programs. And so the key findings under this study indicated that despite GRZ providing 75% of the program and 25% coming from donors, there were delays in receipt of these funds. And so this was one of the issues affecting sustainability of the program. Another finding indicates that the rollout of the social cash transfer program from 50 districts in 2014 to 104 districts in 2016. This notwithstanding, this desire was not achieved. And so there's only been a coverage of 76.9% of the targeted districts as at 31st December 2017.
And what response have you gotten to ensure that at least the right people, the right beneficiaries get that money rather than being directed to where it's not supposed to be? What could have been the response from the government or the authority about the misapplying or misapplication of the social cash transfer, which ends up in the pockets of probably the people that are not eligible to get this money from PMRC? Or what do you do there after the findings? Do you let the government act, or what follow-ups do you make?
For question 1, concerning the money that is being lost through social cash transfer, so if we look at the findings from the Auditor General's report, mostly it was, one of the findings was wrong beneficiaries in the program, and the other one was high administrative costs. Yeah, it was one of, the second one was high administrative costs. And government has realized that these are the two problems that are affecting the implementation of the program. Thus, they intend to move the system onto the online platform, like the e-voucher system. If that is achieved, we'll realize that the program will improve targeting of beneficiaries as it has been improved on the e-voucher system, as well as reduce the cost of administrative costs are going to be reduced because there will be no need for officers to travel to areas to meet beneficiaries and disburse money.
We have come to the end of this event that witnessed the launch of the booklet titled Malnutrition Amongst Children with Disabilities, Challenges and Opportunities for Zambia, and most importantly, the Braille Handover. The study, as we have heard, has provided insights into the available opportunities to improve nutrition amongst differently able children through measures such as the social cash transfer and the homegrown school feeding program that the Minister alluded to. And so the study has also highlighted the obstacles in providing good nutrition to children who are differently abled. And we have also seen that the study has some gaps that we need to cover through the person that came at the end. And we hope that in the second phase, Madam Bessa and her team will be able to tackle those, see that they're important and they're coming from, that question is coming from practitioners who are working in these organizations. Amongst others, publications, these include a lack of access to sufficient nutritious food because of poverty, as well as the widespread misconception and stigma against children who are differently abled. So we hope that we continue this partnership for the betterment of our country. Every one of us has a role to play. With these remarks, I'd like to thank you once again, PMRC team, the committee, for preparing this program and the entire morning. Thank you, and thank you. God bless you all.